Student health care centers at SUNY schools already offer women gynecological exams, breast exams, birth control, and pregnancy counseling. But under a proposed new law, they'd also have to provide access to abortion pills. Kayla Green is following this story for us. Kayla, this is a bit of a controversy, a bill just introduced.
Yes, Maureen, the bill says SUNY schools would have to offer abortion by medication techniques, meaning the abortion pill. Locally, people have mixed reactions to bringing this onto SUNY campuses. Should SUNY students have access to medication abortion on campus? Compass Care Pregnancy Services is a pro-life agency that provides care for women facing unplanned pregnancy. The CEO says this bill isn't well thought out.
You're not providing actual patient care in a student health environment with a doctor-patient relationship ongoing. There's follow-up that's required. There's monitoring that's required, and all this is extracted from the woman's experience on campus. It's dangerous for her.
But the president of Planned Parenthood, Empire Axe, says medication abortion is perfectly safe.
I think that, we're looking at all of that in terms of really making sure that if this is provided on campuses, it's provided in a compassionate way, in a quality way.
The bill would require SUNY campuses to offer medication abortion at all on-campus student health centers. The services would be paid for with a combination of public and private funds managed by the comptroller, the SUNY chancellor, and the health commissioner. Agencies like Planned Parenthood say it's important to expand care to women who might not otherwise have access.
Across the state, and especially in rural areas, we do see barriers in terms of, availability of transportation, proximity to health centers, and affordability of care.
Michelle Sterlace-Accorsi is the executive director of Feminists Choosing Life of New York. She says there should be more money going towards helping college-aged women avoid abortion.
What it doesn't help finance are campus child care centers, any kind of desperately needed prenatal care. I mean, these are the impediments that interfere with women's ability, again, to carry unplanned pregnancies to term, to choose life for their children, and also have a career.
We reached out to SUNY as well as the 3 local SUNY schools, and they all told us they don't comment on pending legislation. Kayla Green, News 8.
All right, thank you, Kayla. California is the only state in the U.S. to require public universities to offer abortion pills at their health centers. The bill in New York State was introduced last week in the State Assembly.